This is Tom Fox, and I would like to welcome you to the latest addition to the Compliance Podcast Network, Greetings and Felicitations. In this podcast series, I'm going to be visiting with thought leaders, entrepreneurs, historians, and a wide variety of other people on topics that are outside the area of compliance, but are of great interest to myself and to listeners to the Compliance Podcast Network. Today we start a 5-part podcast series on some of the science around Star Trek. In this exploration, I'm joined by my good friend Ben Lockwood. Ben is a healthcare futurist, and he's also an astrophysicist, so he's uniquely situated to talk about the science of Star Trek. We had a lot of fun producing this series, and I hope you will enjoy it, listening to it as much as Ben and I did bringing it to you. In this episode 1, we take a look at the episode Mirror, Mirror, and use it to discuss transporters. Hello, everyone. This is Tom Fox, back again with Ben Lockwood as we continue our exploration of some science issues, or perhaps non-science issues, from Star Trek, the original series. Today, I want to use Journey to Babel as an introduction to talk about medical issues, the future of medicine, tricorders, and a wide variety of other topics. So, Ben, first of all, welcome back.
Thank you, Tom. I feel like I'm aging in reverse.
Great. You look marvelous. This was one of my personal favorite episodes. It really presented the spectrum of alien beings or beings in the United Federation of Planets and in the universe that Star Trek inhabited, I should say. On Stardate 3842.2, when this episode occurred, there was a diplomatic conference that the Enterprise was ferrying ambassadors to, one of whom was Sarek. And Sarek is the 102-year-old ambassador from Vulcan, and he was accompanied by his wife Amanda, who happened to be, or is, human. Much to Captain Kirk's surprise, he found out that Sarek and Amanda were Spock's parents. So, first of all, we start off with the greatest trope ever, dads and their fathers, and it kind of goes downhill from there. But there's some great espionage going on. There is a murder mystery of which Sarek is accused of murder. Sarek is attacked, Kirk is attacked, and it all sort of ends up in sickbay with Dr. McCoy, who has to do a has to move some of Spock's blood to his father so that an operation can occur on Sarek's heart valves. The Spock's blood has to be enhanced, and so all of this happens, of course, during a military engagement. So it's really a lot of fun. A lot goes on. We get to see the full panoply of medical services that are available on the Enterprise. Obviously, the tricorder is a key part of almost every show. So, Ben, you're in the life science industry. There's a lot going on here. Where do you want to start?
Well, I think we start at the beginning. Let's talk the tricorder first, and then we'll see where it goes from there. So it's interesting. Like you said, the tricorder is very ubiquitous in a lot of the Star Trek, the original series episodes. And I think there are a lot of people in the healthcare industry now, whether it be physicians in the clinic, nurses, support staff, who are of the era where some of their professional decisions were in part or largely determined by seeing the tricorder, or watching shows like Star Trek with the tricorder. And, wow, I would want to be part of, the future of medicine, and what does that industry look like? We certainly know that folks who go into aeronautical engineering and aerospace, a lot of tech companies, defense companies, they've said that their interest was in large part due to, watching Star Wars, watching Star Trek. These were catalysts for how they see the future and the world they want to participate in. So I think, the tricorder was an absolutely important linchpin for our ability as a society to get people engaged, to go into the profession, to then develop things that were more like the tricorder than ever would have been possible. So I think with that said, having the existence of the tricorder in the show is something that probably in and of itself changed where we are in medicine today in many positive ways relative to not having it. So I think we owe a lot to the show for that.
Can I stop you there, Ben? Because this seems to me to be very different than saying, I decided I wanted to be a doctor because I admired Dr. McCoy. This is actually saying something I think a little bit different, which is I was so inspired by what I saw as the potential science that became an area I not only wanted to practice in, but really wanted to help lead a cutting edge in development. Would that be a fair assessment?
Yeah, I totally agree. And, like I said, I think about some folks who I'd heard in the past, various industry discussions talking about how they were inspired to work on ship designs, whether it be airplanes or rocket ships, because they remember seeing The Empire Strikes Back Star Wars movie or the original A New Hope Star Wars movie, or they were so fascinated by the idea of lightsabers that got them into high energy physics, things like this. So I think this happens quite a bit. I had done some work, a couple to a few decades ago with an archaeologist, and he said that when the original Indiana Jones movie came out, which I think was around 1980 or 1981, that the spike in university students choosing archaeology as their preferred major was off the charts. And, potentially that was local or regional and maybe not, nationwide, but it's interesting that we're shaped, I think, more than people would give credit for due to the media that we consume.
So what about some of the pharmaceutical issues that you saw in some of these episodes? We had a wide variety of medicines, some which were developed literally on the spot as antidotes or cures to diseases that were unknown to the medical staff at the time they occurred, or any of the surgical techniques. Because one of the things that struck me, Ben, was they were really just utilizing 1960 surgical techniques and putting a cool tool in the doctor's hands. They really hadn't advanced literally even to where we came in the 1990s.
Yeah, that's true. I think if we start at the diagnostic aspect, so having the tricorder, whose job is essentially to find out where somebody was injured or there's some underlying disease or disorder, and the tricorder hones in on it. We do have a tremendous array of high-quality diagnostic instruments now available to us that weren't in existence 5 decades ago. In having something like the tricorder be real, I think it presents a lot of difficulties that, the principles of thermodynamics would prevent. Also, some other high-energy physics and electromagnetic issues would prevent in terms of actually being able to realize that. So, for example, if we wanted to transdermally transmit data and figure out what was going on beneath the skin, we have to use certain wavelengths of light, and these penetrate to different depths. So, for example, we've got UVA, UVB, UVC rays, and some of these are, we know and love from people who suntan and dermatologists who always recommend everybody avoids the sun. The different photon energy means the photons are penetrating to different depths. If we take an extreme value, X-rays, we have super high energy photons, which are X-ray photons, and they pass right through skin, right through soft tissue, and we're able to image bone and through bone with X-rays. So in order to be able to read something that's going on, let's say in the blood vessels or the bloodstream, but have that penetrate through the skin, essentially it's impossible, because if the wavelength goes through the skin, it's going to image through the blood vessels, through the blood cells as well. So we can do certain multi-layer targeting effects with imaging for diagnostics, but I think some of the tricorder of course, is interesting science fantasy about being able to read diagnostics. However, with that said, we are also currently in the midst of some Google AI and machine learning algorithms which seem to be predicting lung cancer better than radiologists from radiographic scans. So there's some interesting data available right now that this is actually occurring. So this also is restoring some of the elements of the science fantasy and putting it into our hands as science fact now, which is to have a device vis-a-vis some sort of machine computerized unit which is able to go through its neural net of potential diagnostics and let's say outdiagnose the clinician, who in this case is Bones. So he's relying on the tricorder to give him evidence for what the diagnosis should be, and it seems that some of our machine learning is getting us there now. There were some disappointing trials with IBM's Watson for predicting disease states better than clinicians in some cases, but like I said, some of the newer data with some lung diseases and disorders, the machine learning algorithms at the moment are tending to outperform humans. So if we can get to the point where we would be somehow extracting data from a patient or feeding data into a system, we may get to, in the very near future, a position where the diagnostics are much more accurate, so then we can treat the patients with a more precise therapy. And I think pharmacologically that's where the industry is going as well. So the pharmaceutical side of things, there's an aspect called pharmacogenomics, where right now we're able to map how each individual's personal genetics, their genome, interacts or metabolizes different drugs. And depending on the metabolizer, the person, we would give them different classes of drugs, different types of drugs to treat different conditions because of the way it either works or doesn't work in that particular patient. So we're getting to the point where it's not one size fits all, but we're trying to figure out how to optimize the treatment. And, I think we're also getting a lot more behavioral with it. People who, let's say, want to avoid needles. We're also, as an industry, moving to where we've got transdermal patches which can do essentially what a needle is doing, but without puncturing the skin with a large needle, and everything that brings with it in terms of shock value and fear factor. So I think there's a lot of technologies now that are helping us work around how humans behave. If they're avoiding, let's say, vaccination or needles for a certain reason, can we find ways to instill the immunization, but not go the route of something that people are avoiding? Certainly, there's augmented reality that's being used, medical 3D printing, looking structurally at molecules that were too complex to ever really visualize or imagine in the past, and how those may interact in the body. So there's a lot going on, both on the pharmaceutical side, within medical devices, and I see that the tricorder was an inspiration for a lot of where we are.
Well, Ben, that seems like a good way to wrap a bow on this episode and this 5-part series. This has really been just a ton of fun, and I wanted to thank you again for taking the time to visit with me.
Thanks, Tom. It was great to be with you.
This is Tom Fox again. I hope you enjoyed our inaugural episode of Greetings and Felicitations. As I said in the intro, we're going to be exploring a wide variety of topics, some compliance related, some not. So I hope you will join me in this most interesting adventure. Greetings and Felicitations is a production of the Compliance Podcast Network. We have 2 other great new podcasts out on the Compliance Podcast Network. Check out From the Editor's Desk, where I visit with Compliance Week Editor-in-Chief Dave Lafort for a monthly wrap-up of Compliance Week stories and events, and the ESG Report, the first ESG podcast related to compliance.